it has two heads. Among the two heads, one is sternal head and the clavicular head. Which one is tendinous? The sternal head is tendinous. Okay, it comes from the superior aspect, anterior aspect of the manubrium sternum. And here the next MCQ is it gets inserted into the mastoid process as well as the lateral half of the superior nuchal line. This is the second MCQ. And third MCQ, nerves related to the sternocleidomastoid. So you can see here, this is the sternocleidomastoid. You can see one nerve, it's a thick nerve. It crosses the sternocleidomastoid obliquely and goes and supplies the skin over the parotid gland as well as the angle of the mandible. This is called great auricular nerve. Great auricular nerve, it gets thickened in which disease? Leprosy or Hansen's disease. This is about this one. And when the nerve supply of the secretomotor nerve supply of the parotid gland is auriculotemporal nerve, and whenever there is injury of this nerve, auriculotemporal nerve, when it gets regenerated, this great auricular nerve is supplying the skin over the parotid gland. So these nerves joint and communicate. So what happens whenever the patient feels like eating, whenever there is saliva secretion, the sweat also gets secreted over the skin of the parotid gland. That is called as Frey syndrome. This is also important nerve is great auricular nerve. And the next one is behind the ear. You will be having the one which is going at the back, that is called as which nerve loops around the spinal accessory. We'll see all the stuff. Okay, here first you should know the nerve supply of sternocleidomastoid is spinal accessory nerve as well as C2, C3 proprioceptive fibers. These two you should mention. And this is about the sternocleidomastoid. The action of sternocleidomastoid, one side if it contracts, it produces lateral flexion. Both the sides if it contracts, it produces flexion of the neck. And when lying down posture, when you try to get up, both the muscles they act and lift the head. And the another one is last action is it pulls the chest wall up. So there are 4 actions for sternocleidomastoid. And clinically the important MCQ is when it contracts, if there is a scar formation in the muscle, it may lead to Rhineck or torticollis. This is MCQ related to the sternocleidomastoid. And the next one is, here you will be having the 2 bellies. Here is the anterior belly of digastric, here is the posterior belly of digastric. This is the intermediate nerve. Anterior belly of digastric nerve supplies nerve to mylohyoid. This is nearby, so it is supplied by the nerve to mylohyoid, and the posterior belly is supplied by the facial nerve. So anterior belly is different, posterior belly is different. So here you can see the facial artery. Facial artery is a branch of the external carotid artery and it grooves the submandibular salivary gland. And here is the carotid artery. From the carotid artery, another one important branch comes down to the thyroid. This is called the superior thyroid artery. These are the branches you can see here. So just posterior border of the sternocleidomastoid, you will be having the nerves called spinal accessory, lesser occipital nerve, and the spinal accessory supplies sternocleidomastoid as well as the trapezius, that is MCQ. And here one is going up, that is called lesser occipital. One is horizontally, it's going, that is called transverse cervical, and the one going down, it is called supraclavicular. These are the nerves related to the sternocleidomastoid. Another one we have seen that another great auricular nerve crosses in an oblique direction.